So welcome, doctor. Thanks for being with us. We're going to talk a lot about today her practice, and she'll get into that a little bit. We'll also talk about everything going on with the COVID-19 and what she's seeing as she's continuing to go to work and help everyone. So with that, I just want to remind everyone of the things we have going on right now. First line responders, we're doing free powers of attorney for anyone who calls, and that's been incredibly well received, and we're trying to get everyone in as quickly as we can for that. And then also we're doing 50% off all estate planning services, and it sounds like that may continue because it was only going to go through the end of the stay-at-home order, but it sounds like, and we're going to talk about that, but it sounds like that might be extended a little bit. So I'll turn it over to Pat. Pat has some questions for Katie, and we're going to see where this conversation goes.
Yes, indeed. So, well, question one is pretty straightforward. Mike's known you for quite a while. We only met recently. So who are you? What do you do?
All right. Well, thank you for having me today. I'm excited to come and talk with you guys and go over some things. So a little background on myself. I'm an internal medicine physician, and I'm practicing in Clarkston. I went to Michigan State to the College of Osteopathic Medicine, and did previously some hospital rounds and teaching of the residents, and now I'm in an outpatient only practice here in Clarkston. Recently, in the past year, I affiliated with a company called MDVIP. MDVIP is a national company that works on a membership basis. So it is nationwide. There's over 1,000 doctors in the United States that participate with MDVIP, and over 300,000 patients that are members as well. So when you affiliate with MDVIP, you downsize the size of your practice. So a lot of traditional primary care practices have, 1,500 to maybe 2,000 or more patients. With MDVIP, you would have no more than 600 patients, and most of the practices are actually quite smaller than that. So it's a much more personalized approach to medicine. And it's a membership fee basis on the year. It does include some higher level physical and executive testing that we do with some specialized blood work and things like that. And we also have longer appointment times, better access to your doctor, and that sort of thing. So it's been really good. I've been doing it I affiliated my practice officially in November, but started in July with the transition process. And that's kind of where we're at.
That's remarkable. So you have like 50 to 70% fewer patients than a typical practice?
Yes.
Which I assume means you spend 2 or 3 times as much time.
Yeah. Absolutely. So it really means that if someone needs to get in, they can get in right away. And when you come in for an appointment, you're not rushed. You have long time for your appointment to get your, things that you need addressed. And physicals are longer appointments. Most of the physicals that we do end up being about an hour and a half to 2 hours.
Oh, wow.
We've actually had the pleasure of working with many families that have taken advantage of working with Katie's practice. And from what I hear is they explain it to me as it's like a white glove kind of service where they get more time with you, they get in faster, they just absolutely love it. I hear rave reviews about everyone who's part of the program.
Yeah, thank you. We really try to personalize it for what people need. It's one thing I've discovered kind of going through the process and transitioning my practice from a traditional practice to this type is that everyone has different reasons to participate in a practice like this, and it's really individualized. So that's one thing we really strive is to kind of meet with patients and talk about what their goals are and what they hope to gain from being part of a practice like this. And we can really make it an individualized approach. We really refer to it as personalized health medicine for patients. So
little different than the minute clinic there.
Absolutely.
All right.
And so it's really nice in a time like this too. I would say patients, I think, feel pretty comforted knowing that they have really easy way to get a hold of their doctor if need be, especially when we're going through this kind of crazy times with the pandemic and that you're very easily accessible. And I've had a lot of good feedback from patients based on that as well.
Fantastic. Well, that leads me kind of directly into my next question. When you say times like these, I assume we're talking about COVID-19. So what does that look like right now for your practice and kind of for Michigan as a whole?
Sure. So, it's definitely changed the way we're doing things here in the practice. I'm part of a larger practice called the Clarkston Medical Group. And myself and another physician, Dr. Barnes, are affiliated with MDVIP and kind of have our own office suite within the building. But it has really changed the way that we're functioning. We're doing a lot more telemedicine and telehealth visits to try to, have patients not have to come into the office if they don't need to. When people do need to come into the office, we are checking temperatures at the door and screening for any illness. Our office is running an outdoor mobile clinic, which we'll talk about in a minute, to see patients who are ill, and just kind of watching to see what the numbers do. I looked yesterday. They report every day at 3 o'clock. Michigan reports like their number of cases, and they were at almost 34,000 yesterday, with about 6,400 in Oakland County alone. So, it does definitely seem that we're still seeing a decent amount of cases. It has seemed to come down from where the peak was a couple weeks ago. The numbers did go up a little bit the last couple of days, and we're not sure if some of that is more reporting. And also there's greater access to testing. There's a lot of different places where people can now go get tested, which was pretty limited initially. The results are coming back a little bit quicker. Some of those things, especially reports of deaths, and that had been backlogged. So some of those reports where the numbers jump up higher don't necessarily mean that day that's what occurred, but just some of the information that was backlogged is now being reported.
Okay. Yeah.
What is turnaround time right now on a test?
So our testing that we're performing through our office is about 36 to 48 hours to get our tests back.
Oh, that's pretty fast.
That is pretty fast. Some hospital systems have, for patients who are hospitalized, they can run some quicker testing, but they're not really offering that testing as an outpatient. So that's kind of was our goal with this, is to try to keep people out of the hospitals, the ERs, the urgent cares, because people need to go in there when they're critically ill. They don't need to necessarily go in there just to be tested. So with our lab, that's where we're getting it, which is good. Initially when we started doing testing back 5-6 weeks ago, the test turnaround times were over a week in some cases. So there's definitely been improvement made with that for sure.
Okay. So, and I know that's a lot of people's kind of primary concern. So what exactly is the test? Are you testing for the virus itself, testing for antibodies, and where can people get these done? You guys are doing them.
Sure.
So, yeah.
Yeah. So, one thing we're doing the testing at our office. The test is done outside. We have a mobile unit where patients actually drive up in their car. And those appointments are scheduled, and we'll talk about scheduling in that in a minute. But patients come up in their car. One of the physicians, or we have physician's assistants, nurse practitioners, actually go out to the car to evaluate the patients. We do have full PPE. So, we have the gowns, gloves, masks, and go out. We get some history from the patient. We do vital signs where we check your temperature and your oxygen level, your heart rate. We can do the testing, and, we can listen to heart and lungs if things need to be looked at. We do have the capability, if we suspect maybe it could be something else like strep throat, potentially swabbing for that out there as well. So it's a little bit different than other testing sites that may just be a drive-through test where someone comes out and swabs you and that's it. There's not really any other interaction. Through our office, you are actually seeing a provider who will evaluate you and check for some other things as well. And it's, important because we're seeing such a wide range of symptoms with COVID. It's been kind of changing where we're seeing, initially they would mention cough, shortness of breath, fever are the things to look for. But we've seen a lot of GI symptoms with patients, some people with rashes, loss of taste or smell. So it's really become interesting, the wide spectrum of complaints or symptoms that patients will have and the severity. It's not been typical of other viruses where it's only one or two things that you typically will run into, that we're seeing a lot of wide range of symptoms. So we're really, for ours, we're not limiting it if patients have had, exposure or potential exposure or work in high risk settings, we're testing them. The test is done.
They don't need to do a telemed visit or anything like that prior to being.
Some patients are doing that, but I have offered it up where patients can just call. We do schedule appointments outside just so people aren't waiting. So people call a number and they get in for testing. They pull up and then we get evaluated. Some people have done a telemedicine visit prior, and that can still be done as well, especially if people aren't sure if they would qualify for testing or need testing. And then the testing is done, it's a swab. It's a nasal pharyngeal swab. So there's a small little swab that we use that go up both nostrils, and it goes pretty far back to get a good sample.
I was going to say, isn't it like a 6-8 inch Q-tip goes up your nose?
Pretty much, yeah.
Okay.
A skinnier Q-tip, but yeah, it's not always the most comfortable. So, but that's the way to get the sample, and then so we can do that as well. So, like I said, we're not really limiting it. We really feel that the biggest thing we can do is do widespread testing to try to identify who has it, so that we can, isolate those patients and try to reduce the spread.
I really liked what you said earlier too about having, professional care providers there, because, everyone is so focused on the virus, as they rightly should be, but people are still getting sick with everything else that they used to get sick with too. So when you said earlier, is it strep? It's like people are still getting mono, people are still getting strep, people are still getting the flu and rhinovirus and just all those other things as well. Just because you don't have COVID doesn't mean you're not sick.
Exactly. And, especially the first few weeks when we did this, we picked up a lot of people that did have the flu. We were checking some flu swabs. We've picked up some people with strep throat. One of our pediatricians picked up a young child that had RSV. So, that's the thing. I mean, and we're trying to see everybody out there because you don't know what's what. You don't want to bring them into the office, necessary exposure, but at least this way you can get seen by a physician or another physician extender to be evaluated, and we can decide, you can get your oxygen level checked, your temperature, and, we can kind of see how ill someone appears and give them guidance about what they should monitor for at home as well.
Okay. And this is testing for the virus itself as opposed to antibodies, yes?
Right. So this is testing for the virus itself. So this is really intended for people who are ill, patients who work in high-risk settings who are concerned they may be exposed, or people who have had known exposure.
Okay.
Yep. And so, the number that we just put up here, so that's a number that you can call, and we're not limiting it just to our office. So if you want to call to be seen or to be tested, that's a number that you can call to be put on the schedule, and they will give you a time, and you would drive up our offices in Clarkston. We're right off Sashabaw on Bow Point Drive. And so that's where they would call. I will give a number too. We also have a thing for any first responders. So this is people, EMS, fire, police department, nurses, physicians, that if they need to be tested, we actually have a dedicated line that they can call as well. And that number is 248-384-8326.
Oh, that's really nice.
So
that was one of the questions I was going to have for you is, do you have to be a patient of MDVIP or CMG? And it doesn't sound like you do.
Nope, you do not need to be. Okay. Nope, we're opening this up to the community right now.
Great. That's amazing. I have a question for you about the PPE. That's the term used for like the protection stuff that you guys wear.
Yeah.
How effective has it been, at least for you and your colleagues, keeping you guys healthy? Have you had any of your colleagues get sick and now they're at home? Like, what's that all been like? What has it been like working in these testing units?
Sure. So, no, I think we've been doing good here. So, it isn't just, gown up, we wear an N95 mask, and we do usually put another mask over top of that just to protect ourselves. And sometimes those are paper masks, or we've had a lot of patients who have made us masks that we've been wearing. And then we have goggles that we wear, or a face shield to kind of protect that goes over your eyes. We have gowns, and someone actually made us some pretty heavy duty gowns that we can wear. They're nice also because the elements have not been great so far the last 2 weeks. So we've had rain, sleet, snow, hail, all things like that. But they also kind of keep us warm and protect you from that. And then, obviously we have gloves as well. So the way we've got it set up outside is that we have kind of a fifth wheel trailer that's working back there that the physicians don't go in, but we have staff back there so we can relay some information. They can enter some orders so we can keep track of things for patients and put their vital signs and things like that in. And then we can stay outside so we're not contaminating. We can change in between and things like that as well. So
I think that's really worth going back to for a second. When you say that you're doing the testing outside from the car, consider the weather for the last couple of weeks. I know you are because you're the one doing it. But I mean, hail and snow, and it was 65 degrees one day, and then it is sleeting the next day. And you guys are out there in full PPE, putting swabs up people's noses to keep them safe. I mean, it's remarkable. I don't know. I didn't go to med school, but I don't know how much, field triage they do.
I'll give a lot of credit to our office done through the Clarkston Medical Group. They really, we really started talking about this around March 13th is when things got going. And
there's a picture of their trailer unit kind of.
Yep, there you go.
Very
Yeah,
nice.
they really put stuff together quickly and got things going. And, all the physicians down there and the staff has stepped up. I mean, everyone has contributed. It's really, really cool to see how well everyone stepped up and worked together. And, there have been some of those weeks, there were some of the physicians that were out there 4 or 5 shifts working in terrible conditions and seeing a ton of patients. And, I give all my colleagues a lot of credit for all the work that they've done because and like I said, everyone stepped up. Nobody's turned anything down. And it's been really, really nice to see everybody working as a team and everybody kind of fluid with this because, like I said, things change daily. Like what is happening one day is not what happens 2 days later necessarily. And the guidelines and the recommendations and things like that change so rapidly. So
that's definitely one of the areas where I think our professions cross over, both the law and medicine. People desperately want certainty. They want solid answers. They want things that they can know and count on and depend on. And, we try to give that to them as much as possible. But it's definitely true that even in the best of times, there aren't too many things that are dead certain. And right now, even less so. So kind of having these things, having a test done so that at least either I have it or I don't have it. I mean, that can give, even just knowing you have it, so you stop worrying about it and know that what you're doing, self-isolating, is appropriate, is incredibly valuable to folks.
Especially for people who have potentially been exposed. There's a lot of people who work still with the public who aren't able to stay home because of their jobs right now. And those people should be tested. And then again, it gives them peace of mind. Can they safely go to work? Do they need to stay home? Do they have to be family members? And I think that's been the point of ours, as long as we have the testing available, which initially, there was a hard time getting tests early on, but then we've gotten going and we don't have any issue with that. So our thing is, if you have risk or you're concerned and want to be tested, we can test you.
Okay, very good. Which is good to know because as recently as this morning, I was hearing from people that they were having a very, very hard time getting tests.
Yeah, in different locations, it has seemed to be different. I know in different states, even, it's been very hard for patients to get tested. You have to usually meet some other criteria, be, ill enough. But really, if we're trying to keep people out of the hospitals and, there are some people that may be asymptomatic and have it. And so especially people who are working in high risk situations like grocery stores or nursing homes and things like that, and have potentially been exposed, they should be tested.
No, absolutely. I in fact, my brother tested positive maybe 3 weeks ago. He went through 14 days of isolation, went a little stir crazy, but it was the full time. And so he's still isolating, but not just himself anymore, which is kind of nice. But once then you can do those things and kind of get to the other side of it.
Right. And try to reduce spread. I mean, that's the big point of all this, why we're staying home and watching is just for those sorts of reasons. So.
Hey, Katie, can you touch a little bit on, I'm hearing a little bit about antibody testing. Like what's that all about? Is that going to be available to everyone, or what are you hearing on your end of things?
Sure, absolutely. So, the antibody test is, there's a lot of information coming out about that and how that's all going to work. There's definitely blood tests that can be done. There's also some tests that are more like a finger poke test that they're looking into. So there's a lot of information coming out, and a lot of places are now starting to advertise those. We have to do some of this with caution. So when you test antibodies, there's two different types of antibodies that you can test for. One is what we call an IgM antibody, and that shows more of a recent infection or current infection. It takes approximately like 3 to 5 days for your body, like once you've started having the virus, to form those type of antibodies. Okay. So again, it's not meant to diagnose an acute infection. If you're sick, you should definitely get the nasal swab. So this, the next kind of antibody we can look at is called IgG, and that's showing that you've been exposed or had the virus in the past and are now better. And that usually takes about 2 weeks after having the virus to start forming those types of antibodies. The couple issues that we don't know is that there are many different types of coronaviruses that are not COVID-19. So there's not a guarantee.
I'm so sorry. Can I just cut you off for half a second there? Because when you say there are so many types, I can't count the number of times I've heard people say this is the 19th COVID, as opposed to it was the novel coronavirus that was discovered in 2019. Mm-hmm. Just to say there are a whole bunch of them out there, a lot more than just,
Absolutely. There are a lot of mild cases of coronaviruses that can be seen. They're back in the past, they had seen like SARS or MERS. Those were other types of coronaviruses. This one is because it was when it was formed, was named COVID-19 because that's when it was first detected in 2019. So when they do these antibody tests, it's hard to say for sure that they are only going to pick up, be specific for COVID-19 and not for other antibodies for other coronaviruses that may be more commonly seen. They supposedly check for proteins that are a little more specific, but there's no guarantee of that. So that's one shortfall of the virus or of the testing, is that there's not a guarantee that it's specific for COVID-19 entirely. So this, again, is a field that's kind of changing day by day. A lot of the testing may just focus on doing blood tests for the IgG antibodies showing that you've had a past exposure. So that would be helpful for people who maybe had a negative test but had pretty significant symptoms that negative test meaning a negative nasal swab, but had pretty significant symptoms that sounded like COVID-19. So that was where maybe the antibody test would be helpful to say, you actually have antibodies. Maybe that was what you had. And the other question is going to be what does that immunity look like? So just because you have antibodies to coronavirus doesn't necessarily mean you can't get reinfected, or how long that immunity lasts. We don't know. So it's hard to say it's going to be a free for all, that it's going to say, you've had it, you won't get it again, you're fine. We can't do that with any certainty because we don't know how long that immunity would really last and if it is entirely specific for COVID. So those are kind of some of the downfalls of the testing that we've got to work out. I do think it will become useful. And again, that's something that's changing day by day. Our office is still kind of working through how we're going to do that sort of thing.
Gotcha. I always like those very scientific, those very medical answers to things. I remember it was Steph Curry was interviewing Dr. Fauci, 2 months ago or something like that, and asked, he goes, if you have the antibodies, are you going to get it again? And Fauci's response was something along the lines of, in the past, when people have other coronaviruses and then they recover and they develop antibodies, for the vast majority of them, they can't get reinfected. I can't tell you anything about this one, just to say how that works. So just to be very, hey, you can't make guarantees on this sort of thing.
Yeah, absolutely. Everything is so new and it's changing, and this is a new type of the coronavirus that we haven't encountered before. So to really give any data on that, it's really hard to say. We're hoping that, antibodies will at least dictate some type of immunity, and for how long, we're not sure. But it'll be interesting. I think that's going to be something we're going to hear a lot about. There's a lot of companies coming out with testing and that sort of thing as well.
And we actually have a question right now asking, where can we get an antibody test? Is that a thing that's going on right now, or?
There are some places that are starting to offer antibody testing. Like I said, our office is talking about how we're going to roll it out here. We're having some discussion about that earlier today. So we should have some more information coming on that. We have seen some things advertised, through other like urgent cares and things like that as well. The thing I would always caution is to see what type of test they're running. There's a lot of testing out there, but not all of it is necessarily approved. A lot of it isn't approved just because of how fast everything's come out. But you really have to do some research to see what they're testing and how they're testing before you would just jump to do that, I would say.
So based on everything that you've said to this point, even if everywhere has antibody testing available, there's not really a need to rush out and do it, because we don't even know if it's positive or negative. If it's positive, what that means, like how safe you are you going to get it again? It's not like you go get it and now you can go do anything you want. Right.
And the biggest thing we're looking at is, healthcare workers who are potentially exposed but never really had anything. Maybe that would be useful for them to know if they had an antibody. People who work with the public, maybe that they would get tested. People, like I said, who had pretty classic symptoms of COVID but tested negative, that may be a good test for them. I think that's kind of the most useful situations that I would see. I don't think everybody should rush out and get an antibody test by any means. And I think that's going to change. And I think the biggest thing too is that if you're having symptoms, an antibody test is not what you want. You definitely want to have the swab, because that checks to see if you actually are infected with the virus at that time. Gotcha.
So it's definitely the wrong word, but it's the only one that I can think of. The antibody test is more of like not post-mortem. I mean that not for the person, but for the pandemic, as it were, like a test going forward in the future to say, and once it's behind us, or starting to be behind, testing people for, okay, maybe you are safer out there, or you won't be infecting someone, or you are at a lower risk for being infected.
Right, absolutely. And I think, again, day by day, probably if we had this discussion again in 2 weeks, it would be completely different what they're recommending. That's the one thing. As physicians, we don't usually have tons of meetings, and we've been having a lot of meetings talking about all these sorts of things, weekly, kind of going over the changes, and because everything changes so rapidly with this and the recommendations. I mean, even if you look on like the CDC website, the guidelines are updated every few days on what they recommend you do. So
that was actually another question I had been thinking of as you were talking there. One thing that shifted a lot early on was how early people start shedding the virus and how late, or because people can transmit when they're completely asymptomatic. And from my understanding, even quite a bit after they've started to feel better, if they did have symptoms. Do you know what the current status of that is?
We're usually saying people, like, once you've been exposed, you should be, we're watched for 14 days. Most of the people around 4 to 5 days after exposure will develop symptoms if they're going to have that, but that's not entirely, we have to kind of take all that with a grain of salt, because that can, fluctuate a little bit. There are some other testing methods and ways, the CDC has 2 different ways to determine, when you can go back or when you can return. And one of them is that there's a testing method and a non-tested method. So if you've tested positive for COVID, if you have 7 days since your symptoms started, you have not had a fever for greater than 72 hours, and that's no fever without any medication. So meaning you're not having to take Tylenol or Motrin to keep a fever down, and that your symptoms have improved. After 7 days, you should have, potentially be considered to be okay. We're really looking at more of a test-based strategy, and what that would entail is that a week after you've tested positive, we recheck you and retest for COVID with another nasal swab. And if that's negative, we repeat another test 24 hours later. If that's negative, then we consider that you should be okay. So that's one thing. But some patients will still test positive a week or two later. So that's the thing that's not really, some after a week aren't positive anymore. Some 2 weeks after testing positive are still positive. So it's kind of a hard thing to say. I think the biggest thing is still just to really practice our social distancing and trying to stay home the best we can. If you're out and about, like at a, in public at a grocery store, the bank or something like that, you should really probably wear a mask. And that's, again, really to protect if you are asymptomatic that you could potentially be carrying it, you're not spreading it to anyone else.
Okay. And because there's a couple things in there. One is with, 300 plus million people in the country, even if the virus is exactly the same, it's going to impact those different people differently and for a shorter or longer period of time, one would imagine. But also the protection from the mask. One of those things is from my understanding is it's even more to protect the people around you than it is to protect yourself.
Right.
Like
Absolutely.
if you have the mask, it will block you from transmitting more than it would block you from getting it.
Absolutely.
Okay. Yeah. So there's a whole bunch of information out there. And I think part of the reason that we really wanted to do this is try to clear up, some of those things. Like, can you transmit when you're asymptomatic? Absolutely.
Absolutely.
Right? Yeah. Wearing a mask is not just about you, it's about helping other people out.
Yep.
If you've got it, you might not know it, and you might be unwittingly, contributing to that for other people. Just to try to clear up some of those myths, rumors. People are grasping at straws, so trying to give them something solid to hold on to.
Absolutely. That's, I think, the biggest thing is that if people, have somewhere reliable to go to get their information and things like that, I think that's really helpful. And like I said, that's one thing I'm really pleased and proud of the way our office is run, that just trying to keep people informed and to be there for patients and to answer a lot of questions and that. And patients have been very, very grateful for everything that we've done here through the Clarkston Medical Group and MDVIP, and really happy about that. So.
Well, fantastic. And that's why I put your contact info up there, because I'm sure people are going to have ongoing questions and concerns. And so to have them reach out and try and get some of those things answered.
Absolutely.
That's actually something that happens a lot in our practice as well, is there'll be a lot of anxiety, and there's not actually work to be done in terms of, you don't have to go to court, or you don't have to create a new legal document. People just want a few answers to a few things. And if they get those answers, it just takes the stress level and the anxiety all the way back down.
Yep.
But if you don't know, you're going to the internet, and that's where stuff gets bad. For the field of medicine, for the field of law, the internet is not necessarily the most helpful place in the world.
Okay.
I mean, really we got LegalZoom, you got WebMD, and yikes all around.
That was amazing. I learned so much just then. I don't think I've talked that little in 30 minutes in my life. That's good. That was so good. So good. So just like Pat said, there's Katie's contact information. Check her out on Facebook, but don't rely on Facebook for all of your information when it comes to the truth about all this, right?
Right.
Get your information from your doctor.
Anything
else to talk about? Pretty good, right?
Good.
That was great. Any more questions?
No, just a big thank you for Dr. Katie saying you should give a national news briefing.
All right, there you go.
This is the beginning. Next thing you know, CNN's going to see.
There you go. Yeah.
There.
Well, plus, Facebook, we're global right now, technically. There you go.
All right. Well, thank you, everyone, for who watched this today. Just another reminder. One, get in touch with Katie or her practice if you need testing. We have our 50% off offer going right now for all estate planning services while we are continuing this stay-at-home order. And if you are a frontline responder and you either have questions, need a power of attorney updated, or just one in place because you don't have one, please reach out to our office, 248-792-9193.
Oh, and that's just one thing real quick, Mike, and I think Dr. Katie, you'll back me up on this one, that medical powers of attorney, because that's the one thing that we can do to really help out doctors and the like, because wonderful people like Katie cannot talk to the family unless they're authorized to. So just to make sure you've got those in place in case you or a loved one needs to go into care, that can make a huge difference. From what I've heard from other medical professionals, it's very, very hard to not be able to talk to people, but because of HIPAA and because of laws that are in place, sometimes you just can't. So
Absolutely.
we can actually help make you better, and we can help let her talk to you. So,
Sounds
all right.
good.
Awesome. Well, Katie, thank you so much for your time. Appreciate it. You got to get out there and do some testing today.
Yep.
So be safe, be well, and thank you again.
Thank you.
Take care.